things become severe, it's a problem. When there is prolonged vaginal bleeding, sometimes we hear a woman went to give birth, after delivery, baby was fine. No, 2 days later, they said she was still bleeding. No, someone will tell you at that very day she died, they said she was bleeding. So when the bleeding is heavy, it is prolonged, even if you are still in the hospital, let the doctor know, doctor, they said this blood is not supposed to be so much. Why am I using like 4 pads in 2 hours? So you need to report to the doctor. It's a danger sign. Okay. And then if you go home, because sometimes you are discharged after 48 hours, and that's when everything seems fine, they tell you to go home, to come back in 2 weeks or 6 weeks to see the doctor. Now, if you go home and you notice that the bleeding is still there, you still have this red color discharge, that's blood coming out, then you need to report back to the hospital so they could check what is the cause of this bleeding. Because hemorrhage in postpartum period, it's very dangerous. In fact, it takes a lot of life. Okay. Then if one has foul smelling vaginal discharge, probably after normal vaginal delivery, and she begins to have foul smelling discharge as a result of the cuts that she had. Okay. So if it is not well taken care of, sometimes it's a problem, because it could begin, as I said earlier, the vagina is exposed to the exterior, to the environment, and there are things that could easily attach to it. There's the microorganisms in the environment can attach to it and then cause a problem for the woman. Then if she also has these same things if she has cesarean section and she's also having that is a problem, or she notices that the wound that was sutured is beginning to open or bring out pus, or it's very painful, she needs to come back to the hospital. If she has fever, as I said, even in postnatal period, it is not normal for a pregnant woman to have fever. If she's breastfeeding and notices that her nipples are painful, yes, there's this kind of pain the baby may give when the baby latches, as in when the baby holds the nipple, there's this kind of pain that comes. But the pain is more in the abdomen where the womb is, trying to contract the womb. But if the baby suckles and it's always very painful, and then you look at the breast, you look at the nipple, look at the breast, is swollen, is warm. When you compare the warmth of the breasts, okay, so maybe your normal body or the other one, you notice that it's warmer. And then for those that are fair, you may notice, even for those that are dark, you may notice redness too around it. Please come to the hospital. It's a danger sign. You need to present to your healthcare practitioner or provider. Now, the chest pain, difficulty breathing, easy fatigability, convulsions that I talked about in pregnancy, during this period of postpartum, it's not yet over. Okay, there are still chances for this to occur within 6 weeks, like I said. So most of those things can still occur. So when those things are seen, puffiness of the face, the hand, you just have to present to your health.